We had hoped to bring our guest tonight to the studio 2 weeks ago, but a water main break in front prevented us bringing Cayuga County's Public Health Director, Kathleen Cuddy, into the studio to give us a COVID-19 update and talk about matters of public health, as she did twice in the fall in this studio. She's been gracious enough to quickly reschedule. Maybe even more busy for her now than it was during her last updates, when since the county is now administering several thousand Moderna vaccines in the last month. We've asked her to join us again at the beginning of the semester to talk about what's going on public health-wise in relation to COVID and the flu, and we hopefully will have her at the end of the semester as well to give us an update of where we are. Welcome back, and thank you for rescheduling. I apologize for a water main break.
Thank you, Guy, and you don't have to apologize for that. I don't think you did it.
Oh, some people think. No. So, how are you and your staff doing? I usually start this with you because you are on the front lines. They are the people either testing people, and they do a great job. I was tested in December up at Emerson Park, and I know they've been administering the vaccine. How are your staff handling this all?
They're fantastic. I always start with that because it's true. It's amazing. The people I work with are amazing, and the work that we have performed is incredible and amazing, which we couldn't have known if we weren't in this pandemic.
Even a year ago today.
A year ago today, you know, what we've done in the past year to rise up and address this is incredible, and we don't do it by ourselves. So the clinic you went to, for example, is staffed primarily through our emergency management office. So we've got county partners, we've got city partners, we've got volunteers, we've got healthcare providers. It's an amazing network of people working all to make this happen.
So let's talk about just some general number. We don't need to get into square roots and things like that, but from your perspective, what's our positivity rate roughly right now?
It's gone down considerably, and you would ask me that when I don't have my app in front of
me. That's
okay. But our number of positive people at the moment are 149 people in isolation. And we've had, throughout the time that we've kept count of this, which would have been since last March, over 5,000 cases of COVID in our county.
So at this particular stage, like many counties, are we at a lower number than we have been, let's say, since October or back before the whole Thanksgiving, Christmas worry?
Yes, we are. Just like across the nation, we've seen our numbers diminish.
And overall, do we have an idea of how many deaths there have been?
We have a record of 86 deaths of Cayuga County residents. We believe that's accurate. Checking the New York State site today, it did say 87, so we certainly apparently are off one. We get that information from our hospital counterparts, our nursing home counterparts, and if they're reported to us through the Regional Health Information Network, the RIO. If it's not on someone's death certificate,
right,
we may not hear that result.
So I think I remember reading an interview with you maybe a month ago, and it looked like, and this is separate from the whole issue of the governor, I'm not going to get into that issue, but it looked like about a third of the deaths in Cayuga County at that point, and frankly, if you read the obituary page on a Sunday in the Citizen, you could figure it out. It looked like about a third were from nursing homes. Is that roughly what you think?
I would say at least that.
At least that? Are you surprised at that?
I won't say I'm surprised because it's a congregate setting. The elderly, primarily in nursing homes, are our most vulnerable population when it comes to death. That's, I think, been evidenced also, not unique to our county, but throughout the nation, throughout the world. It's really unfortunate.
So are they, we'll get to vaccinations and your process in a second, but are they being vaccinated, whether it's in Auburn Nursing Home, the Commons, Finger Lakes Center for Living, or there's a whole slew of them in Cayuga County. Are they getting vaccinated as a priority right now?
Nursing homes and residents in nursing homes and their staff are a priority population to be vaccinated, and many and most of them have been. So as you know, there's always in and out. The vaccine goes to nursing homes through the federal government, typically, and not through the state government. So there's a few different paths the vaccine takes. Nursing homes are a priority.
So what do you attribute the I don't want to say dive because that's a bad word, the decline in the positivity rate locally?
I like to think people are conscientious and continuing their preventive behaviors, and I think that's part of it. But we've gotten through the major holidays. There's no question we saw an increase when people gathered together through the holiday season.
I'm assuming you're one of the few people in Auburn that is glad the Buffalo Bills did not make the Super Bowl, because I had talked to somebody in the healthcare and they said, thankfully it didn't occur because we would have had just a major spike. We're at about the time where we might see a spike from Super Bowl parties. Have you seen that yet?
We have, yes.
You have, okay. Do you think the worst is over?
No. To be honest, I don't think so. I like to hope so because vaccines rolling out that perhaps we are evading. I have no proof. I have no data to base that on. It's really just paying attention to what's happening around the globe still. We're not through this yet.
And just the variants of both the South African and UK strains
extremely concerning. That worries me a lot.
So let's talk about vaccines because I think that's what people are concentrating on versus testing. We'll get to testing in a few minutes. But you've started vaccines. You started about a month ago.
Correct.
Any idea? I know you had Saturday, Sunday, and Tuesday for boosters. And I know that from personal experience of talking to somebody, that went really, really well. Do you have any idea how many people have gotten a shot locally here, or a vaccine, I should say, shot?
I'm glad you asked that. We just received some data that gave a sense of percentage of our population. There's a database with the state that everyone who's gotten the COVID-19 vaccination shot, their name goes into for tracking purposes, and it's tracked by zip code. Within Cayuga County, over 12% of the eligible population, over 12% of our population has been vaccinated. But now we know that 18 and under are not eligible right now because we have Moderna vaccine. So probably is a higher percentage of eligible people.
So I thought I read or saw something that Cayuga County was about 9.8, 10%. So we're higher than the general average. Any reason you would say that's the case?
I don't know what the average is across the state or the nation. Personally, I was very pleased to see that the numbers were that high. I know that as a local health department, we have provided over 6,000 shots, both first doses and second doses at this point in time. You know, we get that vaccine out within a week of receiving it. So people are getting it at state sites, people are getting it through their hospital if they're a healthcare worker, perhaps in a nursing facility, at pharmacies. So we're pleased.
So right now, boosters, the second round, those 3 days have done that. Do you have enough vaccine for boosters?
We were informed, and it has been the case, that when we gave our first shots, the state would automatically send us the second doses, and we have been receiving our second doses automatically.
And you mentioned Moderna. Are you getting Pfizer as well, or is it just happen to be this is what you're getting?
It happens to be we're getting Moderna. But truly, we wouldn't be able to accept Pfizer. We wouldn't be able to keep it at the temperature that it needs to be held at.
So who has been, you mentioned several categories, so I'm assuming the priorities have been healthcare workers. Did you get a shot?
I did get a shot.
Good.
And I feel the need to qualify because for people who know me, I'm not 65 or older yet.
No, I know that. No, but you are.
But I work at a clinic, and I have worked at the clinics. And so for that purpose, people who work at vaccination clinics are asked to be vaccinated.
And that's why I'm saying healthcare workers is number one. First responders,
yes,
teachers, the elderly. Has that been the focus of your work at this stage?
The elderly, no.
Okay.
We were asked not to focus on the older population, but to have older population go to the state sites or pharmacies. And teachers, yes, all school personnel were eligible, and public-facing employees like grocery store workers, for example. OPWDD populations, Office of People with Developmental Disabilities, has been a priority population also, particularly people in congregate settings. Now that the eligibility has expanded as of February 15th to healthcare eligible criteria, there are even more people eligible, including our older population. So if you are older and you have a health care condition, the health department can provide that vaccine to you.
Yeah, and just for the record, I am older than you and I don't qualify. So maybe I do. We'll talk about eligibility
Okay.
in a second. So I know there was some other, I do want to talk about some things that have been in the media just in general. So one of the stories that appeared about a month ago was that that Auburn Community Hospital had a very low rate of vaccinations compared to other regional health facilities. Have their numbers gone up?
I believe they have.
Okay.
They are required to submit some data routinely to the state, just as we are. So I expect that those numbers have gone up.
So you mentioned the county and the hospital. Pharmacies, are pharmacies now in Cayuga County giving the doses out?
There are pharmacies in Cayuga County giving doses out. Many of the chain pharmacies are eligible. There's a mom and pop pharmacy who has opted in. And then we're hearing of other grocery store related pharmacies that may take part also. For those pharmacies, it's best to look at their website to see if they're participating.
So I know I'm mostly going to get in trouble, but I would say the big three in Cayuga County are Wegmans, Tops, and Walgreens. I may be missing somebody in there. Are they, for the most part, all doing the vaccine at this stage?
I don't know if they're doing them in Auburn.
Okay.
Like I know Wegmans was doing some in Syracuse and in
Okay.
Rochester at some point, which is why it's important to check their website. We know that Kinney's, for example,
Sorry,
was
there
doing
a
that.
fourth. Okay.
Rite Aid was
Okay.
participating. So we are fortunate that there are a good number. You know, we used to laugh that there's bars and pharmacies on every
Right.
corner. This is a good thing anyways, that there are pharmacies.
There's churches as well.
And
so
churches as well.
Does it mean if we get, say, Wegmans and Tops, Kinney's and Rite Aid and Walgreens, does that mean at some point the county gets out of, with the exception of special cases, the county gets out of doing this?
No, I don't foresee that happening in the near future because there's such a huge percentage of our population still eligible, and we're able to do a greater quantity at a greater amount of time. Whereas pharmacies, their priority is to get medication to people. We can focus on giving vaccine to people. They're doing both. They have to do it at a slightly slower pace than what we're able to do.
Okay. So because you've used BOCES and you get them in, they're there for maybe 15, 20 minutes. It's real. My dad got this the other day. So I can tell you he is in the eligible category of age. So he thought it went smoothly with, I don't know if it was troopers or sheriff's deputies, getting people in the parking, getting people in, your staff. It was very, very efficient, and he thought it was a really positive experience.
I'm glad
from
he felt that way.
From his perspective, from a customer service perspective.
And that's what we want to do. Not only do we want to deliver the product, we know this is strange and anxiety provoking for many people. It's wonderful. The people who work at our clinics, the volunteers, the staff, we've got
We
volunteer.
have college staff here. I know Sue Wilson and others have been
She's
helping.
fantastic.
She's
who works
fantastic
there.
here too. She's
Yeah.
testing us all.
Yeah.
You know, she's one of 3 people we don't want phone calls from here. Is her,
Sure.
one of our deans, and you. Sorry.
But customer service is important, and people, it's important.
It's a horrible
that
way
we
to say it, but it is important.
It is. You put people at ease, and it's a wonderful thing that people are doing by getting the shot, and it's a great service that we are able to offer. And
Well,
so
the
it really
downside
is a
would have
great
been
thing.
if it doesn't go well, it's going to deter other people from getting this.
Correct.
So there's been some changes in eligibility, just almost like a whipsaw.
Mm-hmm.
Who was 75, who was below, you know, who's eligible right now?
The categories we call 1A and 1B as per CDC and New York State Department of Health, and we really have to take our directives from New York State Department of Health. So the latest group, along with those essential workers, and while there are many people who are essential workers, they may not have been labeled within the categories as described by
Right.
the state, and it really has to do with public facing. Now, healthcare conditions, certain health conditions make you eligible.
And so that could be below the, so is the number now 65 or is it 75 still For age alone.
For age alone, it's 65 and up.
So now these pre-existing conditions, which could include diabetes, I heard body mass index.
Correct.
Which would be obesity.
Asthma.
Asthma. So are there any other categories besides those 3 or 4?
There's numerous
oh,
categories.
Okay.
There's an entire list.
So how large a jump does that give you in the pool? If you're at 12.8%, I think that's the number, 12.4, 12.8%, and that's of adults not 18 and below, but that still could be a large pool of individuals who could. Do we have enough vaccine for them?
We do not right now.
Okay.
It absolutely increased our pool of candidates
Get any idea
considerably.
numerically? It's not hundreds, it's thousands.
It's thousands within our county, yes. Which is one of the reasons why we enlisted our cities, towns, and villages, and they agreed to take part in keeping wait lists for their eligible residents within their towns and villages. This enables us as a health department to prioritize our Cayuga County residents first by working with them when we have the vaccine, when we set up a clinic. These town village clerks in the city of Auburn will help enroll people on their wait list.
So when they get on a wait list, do they have to show up with a doctor's form? Not necessarily for you, because they do for you, but how do they get on the, I know the city of Auburn did a blast this morning. Mm-hmm. And I know the other towns, I just happen to be on the city one because I live in the city. These other municipalities, how do they keep the list? Do you have to submit certain paperwork to them?
You do not need to submit paperwork to the town. You do need to communicate with them. So whether it's a phone call or an email to the respective town or village, they will put you on the list. They're going to take your name, your address, and your phone number and email, identify that you're eligible. You don't need to say specifically what that is. The health department will ask you at the clinic, but not.
So then how will you are you going to do it on proportionality?
Yes.
Or are you going to do it on, okay.
Yes. So if we have 200 doses, and that on average is what we've been getting, sometimes a little bit more.
Third goes to the city, but Summerhill may only get 10.
Correct.
And then
we'll keep doing it the next week. We'll do the same thing, and we'll do the same thing.
You mentioned county. I did want to ask this because this is confusing for some people. Do you have to be forget Florida for a second, because we know lots of snowbirds. You and I both know snowbirds who've gone down there to get it. But do you have to be a county resident of Cayuga County to get a vaccine in Cayuga County?
You do not. You need to live in New York State.
Okay.
Which goes to how we've been enrolling people in our clinics. Because priority groupings prior to Monday were employment-based, after the first clinic we had, where we saw about 40% of our people who attended were out-of-county residents, which is perfectly fine, we would like to try and prioritize our Cayuga County residents. So
this is the route to go that way.
This is the route for us to be able to prioritize Cayuga County residents.
You're not denying, but you're saying you have to go through this process.
Yes.
Okay. So a year ago when you were here, we were talking about the flu.
That's crazy talk.
It is. How have cases been? Because if you were here, if we had planned this, which we would have normally done, because we'd like to have you on at least once a semester, we would be talking about flu cases. How are we doing how's the flu impacting locally?
It's out there, but we're not seeing the numbers at all like we once did.
Do you think it's just a direct relation that people are staying isolated and everything that would prevent COVID will prevent flu?
Without question.
Did you see vaccines for flu shots go up in the fall?
You know, I can't speak to that because as a local health department, in the past we have provided vaccine for flu. We didn't do that this year because we were focused on COVID work. So we encouraged people to go to other places to get their flu shot.
But would it be logical to assume that people, because they were getting so focused on getting a COVID vaccine, that they would also get the flu shot?
I sure hope so, and we want to see that happen.
Is it still too late to get it, or are the vaccines for flu shots done?
No, it's not too late. If you talk with our medical director, he always says you can, during flu season and beyond, there is an expiration date on flu vaccine for a reason. You can get it through the typical flu season, which often is through the end of March.
Okay. So still important for people to be thinking of that as well.
Absolutely.
The other area that kind of falls under your purview, and Aileen McNabb Coleman, who will be here on Tuesday, has been how the county has taken directives from Albany to you to give directives to schools. So in part, your department, and I believe the county as a whole, if I'm wrong, correct me, had to sign off on schools allowing sports. Am I correct on that?
Correct.
So what went into that decision process? Because I know your children, some of which are in college, but they're athletes.
Mm-hmm.
So how did that work through your mind?
I actually appreciate you saying that, because I think I want people to understand there is a sense of sympathy and empathy that I bring to the table also as a parent of school-age children. We thought about it a lot. You know, from a public health perspective, it certainly was simpler to say no sports. But we're doing our best to try and open things up and create a sense of normalcy for our community as well as for our children. We had numerous conversations with our superintendents. We had numerous conversations with our local health departments and pulling together guidance across New York State. We got together, video chat. We created a template. The associations really were very cognizant, the athletic associations that the schools work under. So with those conversations, along with conversations with our medical director and our Board of Health, we came to some conclusions and some parameters for our schools to work under.
So what are you allowing, what aren't you allowing?
Everything's allowed. The sports are all allowed, but there's some modifications that may need to be made in order to play those sports. And at this time,
So if you're a hockey parent, you can't go to an Auburn High School hockey game.
So at this point, no indoor sports are to have spectators.
And
So if you're a basketball parent, you're not going to see your child play basketball. But what was really wonderful for a lot of these teams is that live streaming was occurring, so that spectators can, if they have an internet access, watch the game.
And most of them are doing that. And did that limit, because you got a lot of questions from parents, my son or daughter is a junior or a senior and this is important for their scholarships and other things, but they also wanted to go to the games.
Sure.
So they may have not been able to do that, but it did get their students on the court or in the field.
Correct.
Any other restrictions on that front?
You know, the schools have to do, and not just the schools, but any organized sports league has to do screening and keep track of the numbers, and the transportation has to be a certain way. And that played a role in it also. There are many districts you interact with, and these regulations apply to everybody.
But they're also sometimes not uniform because of county lines.
So when there's a lack of uniformity, I think that's where we saw a number of schools opted out of playing against certain teams.
Have you seen any spike related to sporting events at this stage, separate from the Super Bowl?
Sure. There was one team within one of our schools where there were some positive players who were identified.
So the next big issue is opening 5 days a week and for schools. And in Auburn's case, I know some of them, Port Byron I think has been 5 days a week or 4 days, or it's been a much larger schedule than Auburn has. Superintendent of Schools, Jeff Perazzola, was here last week, and you know, he says the two big issues standing before him before 5, besides positivity rate, is social distancing with desks, not 6 feet, but going to 3, and also buses. I'm assuming that while the governor will pass that buck to localities once he's agreed to that, that is an Albany decision at the outset. Am I correct on that?
That is correct.
Okay. So what are you feeling about, you know, all we've been hearing, it's Dr. Fauci or everybody else, I'm sure your office has been saying 6 feet, 6 feet. Do you think we should go down to 3? Is the science there to say we should go to 3?
The science is there to say that classrooms and students and personnel who perform the correct preventive measures, consistently wearing their face covers, washing their hands, not coming to school when they're sick, we have not seen outbreaks
So
that way.
this could be a possibility.
There has been so many changes and so much learning Absolutely, it could be a possibility.
So finally, what's your biggest worry right now?
Getting the vaccine to people who will benefit from it the most. That's where we focus a lot of time and energy, and really reinforcing the importance of maintaining the preventive actions, because that doesn't go away simply because a vaccine is out and available.
Are you worried? So we talked about this last year and the year before. You will not use this term, I will, so please blame me. So there is an anti-vaccine, they're called anti-vaxxers. Mm-hmm. There's been a question about a number of vaccines over time. Are you getting any protests or feelings, or maybe because they don't apply for it, do you still think there's an anti-vaccine contingent locally or regionally that's a worry for you from a public health standpoint?
Yes, I think anyone who takes a platform to negate the importance and the relevance and the scientific-based benefit of vaccines is a detriment to the public as a whole. If people had a true appreciation of what some of these vaccine preventable diseases did to children and adults, which we're lucky enough for most of our lives that hasn't been an issue, measles or
Right.
mumps.
I
Polio.
remember standing in Genesee Elementary, and you stood in line, and you either got the sugar cubes, or there was a nice lady who stabbed you with a needle at that time.
Right. Just our parents' generation dealt with polio as a common occurrence. Really serious health effects and death that came from these now controlled through vaccine diseases.
And so
Vaccines
those
are
who
important.
also are using a national form are a problem as well.
I agree.
I know there was a whole thing with Robert Kennedy Jr., I think last week, and just the information that's out there, or the misinformation that's out there.
The misinformation, I would call it, yes.
Last item, because we've talked about the variants, is, and I'm sure this is at your house as well as it's at my house and everybody who's watching this, we're tired of being cooped up. The good weather might get here at some point.
We hope so.
Sans another snowstorm or something. What is your worry about COVID fatigue?
Well, we know it's real, right? And it seems to go in waves, doesn't it? We felt it as the cold weather started to approach us before the holidays began. I think we all have to remember we all want what's good for our economy. We all want what's good for our children and our schools. And we have to reinforce each other when we get tired, or when we get down, or when we get frustrated, that the actions we're taking, we just have to plow through it, and we can do it, and we've been doing it, and the outcomes are going to be so much better for all of us in the community, nationally, globally, if we can do this. Just, we need to reinforce each other.
Stay 6 feet apart, wear your mask, wash your hands.
Correct. Stay home when you're sick.
Stay home when you're sick. Our guest has been Kathleen Cuddy, the Cayuga County's Public Health Director. We want to thank you for giving us this update. Hope you'll be able to come back later in this semester to give us an update. We'll talk about other public health issues, because you do other things.
We do.
There, and we've tried to talk about WIC and other programs, but we do want to thank you for your time and for your efforts on behalf of the county.
Thank you.
We will be back on Tuesday with Cayuga County Legislative Chairwoman Aileen McNabb Coleman, who will be in to give us a legislative update. She'll also talk a little bit about her new upgraded role at the legislature, as well as what's on the agenda for the county in the coming months. In 2 weeks, we're going to try to bring Mayor Michael D. Quill back to the studio for the city update, after we've had to cancel the last two Tuesdays with him because of snow emergencies. So he'll hopefully be here in the studio on the 2nd. We also have a number of other guests who will be here in the next couple of weeks. That include Assemblyman John Lamondes, City Manager Jeff Digert, Port Byron Superintendent of Schools Neil O'Brien, the Dean of the Cayuga County Superintendents of Schools. He's about to end his service in Port Byron as he retires. Auburn Superintendent of Schools Jeff Parazola, as well as Police Chief Sean Butler, who is also retiring this year. And we'll also have East Hill Medical's Executive Director Keith Cutler. His agency is celebrating its 50th year when it was founded here in Cayuga County. We also hope to bring you updates on local spikes in domestic violence incidents, as well as increased opioid overdoses. We don't think they're necessarily connected, but we would like to talk about that as well in a future show. We'll also do a Zoom forum with the candidates for the Auburn Large School District in April, and I'll moderate that forum, and as usual, the Citizens Executive Editor, Jeremy Boyer, will be doing the questioning. Before we go, though, we would like to let you know that you can send us your questions and thoughts for future guests to Inside Government or Beyond the Front Page. You can email them to cozguytho@aol.com, or Inside Government, mail them to Inside Government, 141 Dunning Avenue, Auburn, New York. I'm Guy Cosentino for Cayuga Community College. Thank you for watching. We hope to see you back here in the studio on Tuesday. But in between, have a good night, have a great tomorrow, and be safe. So speaking of open, who